Oh,
Well, there you go. Now
Okay.
I think we're live. How about that?
Yeah.
This is new technology. But, hey. So, anyway,
Yeah.
so we're here. Hi, we've actually made it. And we would like to talk to you a little bit about LED. And I would say that's probably one of the number one questions that people have for us. Like, what's the deal with LED? Does it actually do anything? And, well, I'm going to say definitely yes. And use it a lot in the treatment room, don't you?
Yeah, I think every treatment can benefit from it. Lots of different skin types can benefit from it, depending on what you're looking for in terms of results. It changes how frequently we would use it or what type of LED we would use, and we'll talk about that too.
Cool. I remember we first hit the industry, and it was almost maybe 27 years ago. And the first that I know of, the first LED light device was introduced at Cosmoprof in Italy. And I remember specifically because everybody was kind of, goggly about it. And Americans in general were like, that's stupid, that's crazy. But Europeans have a different approach to skincare and always had a different approach. So they were a little bit more, shall we say, willing to experiment. And the companies that had come out with it were like, wow, we're really seeing some serious results with this. You've got to try it. And I remember using it way back then. I don't even want to say how long. It's been a long time. And it was really interesting. Now it's light emitting diode. So it's not a laser. It's not just a light bulb. It's not, it's not like a flashlight or something. It's a very specific wavelength of light, depending on what color you're using, that will penetrate the skin and stimulate collagen production or help to stimulate collagen production. And just as a disclaimer, we are not doctors. We are not medical professionals, and we don't play one on live streams.
At home.
Or at home. No. I mean, we're all guilty of maybe a little bathroom surgery here and there, and anybody who has acne can probably relate. So, yes. So when we finally started integrating LED on a regular basis into the treatment room, it was like, oh, hey, this is pretty cool. And then when we, looked a little bit more into the research, like, well, where did this all come from? And most of the research on LED that's used today was done at the Marshall Space Center. So for real, legit NASA scientists were using it or studying the use of LED to help with pain relief. Because, when you're going up into space, I mean, you don't really know what a couple of aspirins are going to do or ibuprofen's going to do when you're in zero gravity. But LED light was reliable and safe. So there you go. Here it is. It's here now, and we use it all the time. Amazing.
I feel like much of what we use in the treatment room is somehow a toned down version of other technology that's used in more of a clinical sense. And then we're able to use it here on our clients so that way they can get that result, but don't have to worry about something that's a lot more intense or more ablative. So that way it's a little more digestible. And it makes it easier for us to help treat varying things if we have something that's a little lighter than what you would get there, but still stronger than what you would be able to find on your own.
Yeah, absolutely.
It meets that middle ground of what we're able to help you with, and then also helps with what you can do at home.
Good point.
Thank you.
So, well, of course, I mean, you are the bomb. If you don't know, this is Stephanie. I'm Lori. I'm the owner here at Viriditas Beautiful Skin, and this is Stephanie. She is our senior esthetician. She's amazing. And she might blush a little bit because, I'm just going to say she's amazing. She's amazing.
Thank you.
Love her very much, and the clients love her too. So, okay, so LED. Yeah, we actually, it's funny that you bring that up because the idea of using, other technologies mostly from wound care, believe it or not, from most of the technologies that are adapted into skincare are derived originally from wound care. So even the idea of using like a full face collagen mask, that practice was originally, used for burn victims. The idea of stimulating collagen production had to do with helping people with scar revision. And I mean, ultimately, lines, wrinkles, and such, they're a kind of scar. So LED, yes, is helpful. It helps to rebuild collagen or stimulate the rebuilding of collagen from the inside out. So it kind of plumps the skin pushes from, gives you a little plump from the outside. So the LEDs that most people are familiar with are red and blue, and they're measured in what are called nanometers, which is basically the wavelength of how deep it goes into the skin. It's a wavelength of light, basically. Red that's used for LED therapy runs at around 630 nanometers, and blue light, which is usually used for acne, runs at about, was it like 415? It's about 415 nanometers. Yeah. So it's an interesting thing. So there's all different kinds of light, LED light that's used. It's basically fractions of, sunlight. And people often say, well, isn't the LEDs, is that going to burn me, or is it going to give me sun damage or something? No, the wavelengths are isolated from sunlight and concentrated. So it's, when you go to the beach, well, for some of us, not as light-skinned people, when you go to the beach and, you sit in the sun, you go, oh, it just feels so nice. It's that really, really intense light. It's good for like maybe 5 minutes for me, and then I'm done. But the part of it that feels good, that makes you feel relaxed and makes your body produce endorphins, that's actually the red wavelength of light. So when we're using it in the treatment room, there's a lovely relaxation aspect to it, and using it at home, same thing. So, we definitely recommend you use it.
Yeah. When I explain things to people when they ask, why is it effective, or why is it different than just any other kind of light, I like to think of the fact that all organic beings benefit from light. More often than not, they thrive in some variation of light, or they adapt to areas that don't have any light at all, which is why a lot of the ocean isn't explored, because it's very dark. But when you have a plant and that plant is on your windowsill and it seems like it's looking a little droopy, and you've tried watering it, or you've tried adding all sorts of food to it, and it still doesn't seem to work, sometimes just rotating it and putting it in some different sunlight can really perk it up. So our cells need the same thing. That's why it's great to go outside every once in a while and touch some grass and put your skin in the sunlight, just to kind of give it that boost. So why not use something that's a synthetic form of that, that's a lot safer, that doesn't risk that burning factor, that you can expose your skin to different wavelengths of it to give you a more beneficial approach without worrying about all that having to be outside with people thing.
Yes, there are definitely days that I could use less people. It's interesting too that you mentioned, enjoying that sunlight, because the radiation that we get when we get a sunburn, like when we go, for example, to the beach, or we're getting that whole spectrum of light, but we're also getting UVA, UVB, and UVC radiation. A little tiny bit of UVC, but mostly UVA and UVB. When you're using a red LED device, you're not getting the UVA or UVB, those are types of ionizing radiation, which means that they cause cellular damage and they ultimately can lead to cancer. So using LED devices is eliminating, for the most part, that risk. And let's be real, red light feels really good. It definitely, you hear about people who are like so-called addicted to tanning. Well, part of the reason they're addicted to tanning is because they're getting a huge, intense dose of red LED mixed up with other wavelengths of light, but they're also getting ionizing radiation. But it's that red LED that makes them feel like, I just really need that. And it can be really helpful for people, especially with seasonal affective disorder. So, So anyway, we're talking about a little bit about the nanometers that happen, and red LED, of course, is about 630 nanometers, and it penetrates deeper into the skin than other frequencies of light. So red LED will actually penetrate all the way down into the dermal layers, which is where the blood vessels and nerves and all the good stuff is. That's where the body is producing collagen. And colors like blue or green don't pass as deep. Blue light is pretty interesting. It is used most of the time for acne, and it's funny because, well, sometimes people say it kills acne bacteria, but it doesn't really kill acne bacteria. What it does is So the acne bacteria create like their waste material, and that's often called a porphyrin. And it's basically like bacteria poop, okay? And the blue LED has a chemical reaction with the porphyrins or the bacteria remainders and makes them toxic to the bacteria. And that's what kills the bacteria. So it's not like, oh, just, some blue light is, going to fix everything. It's not, but it's definitely going to give your skin a leg up and make it easier for your own body to address whatever infection is going on. And it's interesting. I have a little blue LED here right now. This one is from LightStim. This is the ones that we do use in the treatment room. And I'm not going to do it directly at the camera, but you can see it's got a whole bunch of little lights there. And there's a switch on it, but it's funny. It doesn't really look like it's blue. It looks like it's kind of a purple because that's the wavelength.
It's more of a violet coloring
Yeah,
to it.
kind of a violet color.
That's a choice that LightStim has made. Sometimes blue looks a lot more of that true blue color, and sometimes they mix in a couple of red diodes with the blue because it creates a little bit more of an effect and more of a wide spectrum exposure for the skin, which is why it can also help something like this with inflammation, can help with redness, can help with any other kind of beyond just acne treatment.
And as you can tell, it is really bright.
It's quite bright.
This is about a foot away from the wall behind me. And I am not going to look right into it because this strength of LED, not the nanometer, but the strength, this is how many bulbs basically are in it, is so strong that it could cause sensitivity to your retina. I did make the mistake once of looking right into the blue LED. I will never do that again. It was accidental, but I did see, burn spots for probably 15, 20 minutes. So we don't recommend that you take these things fluffily. Is that a word?
Yeah, I think so. It's, even though it seems like it could be really harmless, how much can light really affect me, but the whole science behind what makes these devices so helpful is because of how deep they are effective. So the brighter it is can also mean that it's going to span a little further along the surface of the skin. How strong that nanometer is also depends on how deep it goes into the skin. So a couple of different factors, even though it seems like how hard can light be affecting you, makes a huge difference. So we recommend firmly that people wear goggles or some form of eye covering when they're using it, even something that's a handpiece that you can change on the face where it goes, protect your eyes. Don't put it directly over your eyes, no matter what the directions say you can do.
No.
And
Good point.
also, if you're using it on someone else, like when we use it, we definitely do not look directly into it. Also have made that mistake.
Yeah.
Which is a rookie mistake, and we've learned from it.
Yeah, I mean, you learn from everything, right? We have a full face panel here in the studio, and it's big. It's like two great big panels that open and fold. And in order for it to be effective, you really want to put it super, super close to the skin. It loses intensity exponentially the further away the light source is from your skin. So you really will get the best result when it's right up against the surface of the skin for skincare benefits, mind you. It's the light is still going to help you, with mood and so forth, even if it's not flushed up against the skin. But if you're looking for an actual skincare result, you need to have it nice and close. And using it consistently is going to give you the best benefit. We're talking about treatments like this that are, so-called holistic, or maybe some people might call them alternative or integrative. They're gentle. They're not aggressive. They are supportive. They're designed to support overall health and to help your body be able to do what it should be doing naturally. Maybe just kind of reminding it what to do, because, as we get older, our skin forgets to be fabulous and beautiful. So sometimes we need a little bit of help. So LED is one of those things that can help you. So I hope you enjoyed this. If you have questions, please reach out and we will hit you up in the comments coming soon. Thanks.
Yeah, thanks for tuning in.
Thanks.